Health reimbursement arrangements. Let's take a look at what it is and how it works. A health reimbursement account, or HRA, works with your health plan to provide funds to pay deductibles, copays, and other out-of-pocket costs. High-deductible health plans have a lower premium than a traditional health plan, which means more money stays in your pocket. However, the deductible is usually higher than a traditional plan. Your employer helps you pay for the higher deductible by putting money in your HRA account annually. For employees, the combination of reduced premiums and funds available from the HRA result in lower overall costs than a typical traditional health plan. For employers, the higher deductible plan, coupled with an HRA, amounts to less than the cost of a traditional plan. Both employer and employees share in the responsibility for spending. This is an example of an HRA that pays first dollar coverage and is shared. Mr. Smith is married and has 2 children. His plan has a shared family medical deductible limit, along with a shared HRA allocation. The shared HRA allocation is the amount that one person or all members in the family combined can access to reimburse qualified medical expenses. Mr. and Mrs. Smith and Johnny Smith receive medical care. The HRA starts reimbursing their qualified medical expenses right away to help offset the cost to them. One member can use the entire allocation amount, or a combination of members can use the allocation. Now, let's look at an example of an HRA that pays first dollar coverage and is embedded. Mr. Smith is married and has 2 children. His HRA plan has a specified member-level allocation, along with a specified family-level allocation. This means that each member of the family has a specified amount of the allocation that can be used to reimburse his or her individual expenses. And combined, all members of the family cannot use more than the family allocation amount. Mr. Smith receives medical care that exceeds his member-level allocation amount. The HRA will only reimburse his expenses up to his member-level allocation amount, so Mr. Smith will have to pay the remainder out of his pocket. Later, Mrs. Smith receives medical care. Because Mr. Smith was limited to the amount of allocation he could use, there are still funds available to pay for Mrs. Smith's services, up to her member-level allocation amount or the full family amount, whichever is less. Let's look at an example of how an HRA works. In this example, the member pays first and the deductible is shared. Mr. Smith is married and has 2 children. His plan has a specified family-level deductible that must be met before the HRA funds can be accessed. Mr. Smith receives medical care but does not exceed the family limit. Therefore, Mr. Smith is not yet eligible to access HRA funds and must pay the full amount out of his pocket. If Mr. Smith's expenses, combined with his family's expenses, meets the family limit, then Mr. Smith and all family members will have access to HRA funds. Now, let's look at an example of how an HRA works when the member pays first and the deductible is embedded. Mr. Smith is married and has 2 children. His plan has a specified member-level deductible and a specified family limit. Mr. Smith receives medical care that exceeds the member-level maximum deductible. After Mr. Smith pays the member-level deductible out of his pocket, he will be able to access HRA funds for the remaining deductible. If Mr. Smith's medical costs were lower than the member-level amount, he would not qualify to access the HRA funds. However, if the combined medical expenses of his family members meet the family limit, Mr. Smith and all family members will have access to the HRA funds. Because a Blue Cross HRA is completely integrated with our claims payment system, we can offer automatic claim reimbursement. Here's how it works. You see the provider. The provider submits the claim to Blue Cross. Blue Cross evaluates the claim according to your high-deductible health plan benefits. Then pays your provider. Charges eligible to be paid by the HRA are automatically taken from the HRA account. You will receive an electronic explanation of benefits, EOB, from Blue Cross, showing the part of the total claim paid by your high-deductible health plan and the portion paid by the HRA account, and what you owe, if any. If your HRA is exhausted, your doctor will send you a bill for deductibles, co-payments, and out-of-pocket expenses that are in excess of your HRA fund. We hope you have a better understanding of HRAs and how they work. Thank you for viewing.